Hello, and welcome to our Robert Wood Johnson Foundation First Friday Google Plus Hangout on improving healthcare value through OpenNotes. First Fridays are one way the foundation uses to make grantees and others in the community aware of our work in advancing the culture of health. Today our focus is on how giving patients direct access to clinicians' notes about them can really foster transparency and improve value in healthcare. I'm Susan Dentzer. I'm Senior Policy Advisor to the Robert Wood Johnson Foundation, and I'm delighted to be joined today by three terrific speakers who will flesh out all of our understanding about OpenNotes and its connection to improving value in healthcare. First, I'm very delighted to be joined by Ann Weiss, who's the Director of the Value in Health and Healthcare Portfolio, or arena, I should say, at the Robert Wood Johnson Foundation. We're also delighted to have with us Jan Walker, who is co-director, along with her colleague, Tom Delbanco, of OpenNotes. She's also assistant professor at Harvard Medical School and a member of the research faculty in the Division of Medicine, General Medicine, and Primary Care at Beth Israel Deaconess Medical Center in Boston. And finally, we're really happy to have with us Connie B. Connie is a patient with diabetes and some other conditions. She's enrolled in Group Health, which is based in Seattle. She's adopted OpenNotes, as has Group Health, and Connie is a user of OpenNotes, and we'll hear more about that in a moment. In an age of letting it all hang out, Connie has asked us to keep her last name to her only, so we're going to refer to her today as Connie B. And Connie, we're very happy you and others could be with us today on the Hangout. We do hope those of you participating in this Hangout will tweet us your questions for speakers. The address is on the right-hand top of your screen. It's, as you see there, hashtag RWJF 1ST as in First Friday. And even if you're not going to tweet us a question, if you would just, if you're a Twitter user, please go ahead and tweet it, introduce yourself, identify yourself to us as a Twitter user so we can stay in touch with you after the Hangout. With that, we're going to turn first to Ann Weiss, who's going to tell us a bit more about how the focus on transparency in healthcare really is linked to the Foundation's focus on improving the value of healthcare, the quality and the cost of healthcare, and how and why supporting OpenNotes is part and parcel of all of that. So Ann, over to you.
Thanks, Susan. I'm so delighted that we have this opportunity to raise OpenNotes up and talk about its really beautiful alignment with the Foundation's broader vision for a culture of health. And that vision is basically for a culture in which everyone in our diverse society has the opportunity to live the longest, healthiest possible life. Now, to build a culture of health, as a nation, we're going to have to get much better value from our investments in the healthcare system, much better health and healthcare outcomes at an affordable cost. And that means that we're going to need patients and families and the providers who care for them to become more engaged in choosing care that truly does add value, that helps us live those longer, healthier lives. To make those choices, we can't do that if we don't have access to all the possible information about our care. OpenNotes offers the really transformational possibility of engaging patients and families and activating them in their healthcare choices. OpenNotes helps strengthen the partnership between patients and providers. Sharing information can help providers learn what really matters to their patients and how it will really encourage conversations about which care choices will help patients meet their needs and goals, will honor their preferences, and also you'll hear here today the potential for OpenNotes to identify care that's unnecessary or unsafe. We think that OpenNotes has the potential for really striking impact on the quality and safety of care, on respect for individual and family preferences, for better experiences for patients and caregivers, new opportunities for health professionals education, And again, the opportunity is to really take a hard look at the costs and the value of the care that we're getting. So I'm looking forward to some really great dialogue today about how the transparency of OpenNotes will help accelerate a time when all of us can live our longer, healthiest, best possible lives. Thanks very much, Susan. I'm looking forward to it.
Well, great. Well, thank you so much, Anne. Now let's go over to you, Jan Walker. You, as I said earlier, are co-director of the OpenNotes project. What was it that led you and your colleague Tom Delbanco to see a need for OpenNotes, and what are the various phases through which the project has moved since you first launched it?
Thank you, Susan. Those comments from Anne were just spot on. We initially started this project because we too believe the patients need full information in order to be completely engaged in their care. And with the onset of electronic medical records and online access to information, this became really possible in a global way just recently. And OpenNotes is really a very simple concept. Providers often give online access to patients to their medical records these days, but one thing they haven't done is give them access to the notes that clinicians write about them after encounters, after office visits, for example. So what we have done in this what started out as a research project was simply to give primary care patients access to the notes that their doctors wrote after a visit. This has the study was very successful. It really kind of surprised us. Patients absolutely loved it, and I'm hoping we'll get some questions about exactly what happened with them, and Connie will talk about it from her perspective. And the clinicians actually didn't mind having these notes open to patients. It worked well for them too. So since that study was completed and actually published a few years ago, we have really pushed to have this idea adopted in institutions across the country, with the result that today we have grown from that original study with about 20,000 patients to today having about 5 million patients nationwide having online access to their doctor's notes, as well as to notes by other clinicians, nurses, and so forth. We've also found out that patients look at notes in an ongoing way. It's not a matter of just looking once and then out of curiosity they do continue to look. And we now have some patients nationwide that have had access for 5 years and they're still reading notes, and they're telling us they get a lot out of it. In the future, I think we have the opportunity to even go farther with this movement and looking at moving hopefully from this passive reading of notes that OpenNotes has been so far to perhaps finding ways for patients to contribute to notes, actually co-authoring them with their clinicians, if you will. And then we think that will be a mark of really moving forward with co-authored care, so to speak.
So OpenNotes is giving way to our notes, or will be soon.
We hope so. Co-generated notes would be a definite addition to this movement. And we'll talk a little bit about what the details of that might look like.
Great. Well, thanks, Jan. So Connie, to go to you, as I mentioned, you're a user of OpenNotes. You became one when you joined Group Health, a large health plan and provider organization based in Seattle. You joined not too long ago. Tell us about your experience, and did it result in the partnership that Anne mentioned earlier, the collaborative relationship with your doctor, and really the improved sense of empowerment that so many patients describe with OpenNotes? What happened?
It was amazing. When I joined Group Health, OpenNotes was already part of what they were doing. I didn't realize that it was something new. I had been out of the healthcare system for years, and I thought that it was just something that had developed into a mainstream activity while I was gone. To find out that that wasn't the case surprised me. As you mentioned, I knew that I had diabetes, but I had been without care for approximately 6-7 years. So my blood sugars were off the charts. I had the other complications that went along with that, with neuropathy, diabetic retinopathy, all kinds of things. I also am significantly overweight, and I knew that that had to change as part of all this. And when I went in for my first visit to group health, to my primary care physician, she was fantastic. But one of the things that made that first visit less scary was that we actually did co-author those notes. She turned the computer screen around, and as we were talking, she would be taking notes, but I could not only see what she was writing, but she would pause and say, "Look, I hear you saying this. How should we put that on here?" And so I felt not only heard much better, but she got a better sense of what I was actually saying for information to make any diagnosis or input on like further care and what she wanted to refer me to, and I got the sense that this was happening correctly. I didn't feel like I had to censor myself on what I was saying because I had another opportunity to correct any information that was going on down the road. One of the things that came up especially is when you're a patient, you're sitting in the doctor's office, and you're about to get a diagnosis. You don't know what it is. It might be something big, it might be something small, but something's coming. I always brought a family member or a friend along with me to help make sure that I'd ask the questions that I wanted to ask, or help me remember, what a doctor had said. One of the times when OpenNotes really came in handy is I was referred to an ophthalmologist for the diabetic retinopathy. They had done the eye scan, and while I was waiting to find out what the results were going to be, he came in and he sat me down and he told me, this is the diabetic retinopathy, which I thought might be something to do, and I thought, okay, what's next for that? It's not something that I'd looked up beforehand, even though I tend to be kind of an internet freak and trying to keep track of everything that might be going on. And then he said that the treatment for this was going to be 4 to 6 shots in my eyeball, spread out once a month. And I have to say that from the time he said that, I didn't hear anything else. Anything that he had said to me was filtered through my mind as they're actually going to be giving me a shot in my eyeball. The OpenNotes from that, after that appointment, I went home, and it was still kind of reverberating around in my skull, but because of OpenNotes, I was able to actually pull up the after-visit summary and actually look and see what he had actually said. I had to read what I had actually said. I wasn't even sure of that, but it helped me get myself back under control and able to move forward. I should also say that part of what happened with me in an ongoing thing, my blood sugars, that sort of thing, is something that had to be controlled over time. I had to be kind of like herded slowly into being into compliance and being in better health. For people in the audience that would know, my A1C was over 13 when I first went in November. In January, it had come down, and when I got my last A1C, it's at like 8.3. That wouldn't have been possible without OpenNotes. I can go through, and even in between visits, you talked about people going back and using them repeatedly. I pull them up all the time. I have them. I even printed them out finally, and I have Post-its and stuff all over them. I guess I'm kind of jumping the gun on the RNotes process, but I it's been important to me because it's something that I have to deal with every day. And I know myself, I can fall off the wagon a million times going through this. But because of OpenNotes, I'm allowed to go back, look at those visit notes, go through all the things that I said, all the things my doctor said, and I can put myself back in the position of being in control, and I can start over again. And by having direct access, I can do that at 2 a.m. You know, if I decide, you know, if I had a meal that wasn't great for dinner, and I was late taking insulin and all that sort of thing, and the day had just gotten away from me. If at 2 in the morning it's bugging me that I slipped up, I can actually go to my visit summary, read it through, get myself almost re-empowered, and get up the next day and start again. I don't want to even admit how many times that's had to happen, but it's worked. It's worked over time for me.
Well, that's fantastic, and what a marvelous account of the value of OpenNotes. So, as we've heard, value is an issue. Getting more value out of healthcare is an issue Robert Wood Johnson Foundation cares very deeply about. And as Anne said, OpenNotes is a very important vehicle that can help get us there in terms of strengthening the partnership between providers and patients, enabling a greater sense of engagement, and even helping to identify not only the care that is needed and wanted, but also care that might not be needed or necessary or might even be harmful for patients. So it really is a vehicle that could deliver on a number of objectives. As we heard from Jan, the project has grown remarkably in recent years, up to 5 million patients now in systems that are using OpenNotes, and the evolution to RNotes being potentially a way of even bringing a deeper level of engagement into the process of OpenNotes. And then we just heard from Connie. She's already on OpenNotes by virtue of not only using, or I should say RNotes, not only by virtue of using OpenNotes, but also enhancing it with her own Post-it process so that you can get that feedback process going with your providers. And Connie, your story of how you were able to use OpenNotes to jog your memory when you couldn't, were just overcome with anxiety when in the description of meeting with your ophthalmologist is really a powerful illustration of the value of OpenNotes. Plus, as you said, being able to lower your blood sugar to such a degree, it clearly is the case that OpenNotes is giving you an enhanced sense of empowerment in the care process. So on that final point about the empowerment, the engagement, the adherence, Jan, how common are those things that Connie describes among the users of OpenNotes? You compiled a lot of feedback from surveys of patients. What do they say?
So Connie raised exactly what a lot of patients tell us. And her point about going back to notes to remember, I think, is perhaps the most common thing that we hear. We've all had experiences where we've gone to the doctor, and even though we're well, it's a nerve-wracking experience. It's an anxious experience, and we know that when we leave the office, there are things that we don't remember, and there's actually research showing that that is the case. And not only that, but some of the things that you remember after a visit are actually not right. So this ability to go back to that written record is perhaps the biggest part of notes. But reading notes does other things too. We hear from patients about having a light bulb go on about something. There's something about seeing something in black and white, even after you've heard about it from your doctor or other clinician. There's something about seeing something in black and white that sometimes makes you wake up and say, oh, okay, I get it. And we've heard this from patients about taking medications where they might not have been convinced that they really needed a medication. We hear it a lot about blood pressure medications. But seeing it in writing makes them say, okay, I get it. I need to take this medication. Or weight is another one. People have said to us, you know, I saw in my note my doctor called me mildly obese, and I'm certainly going to fix that. I don't want to see that in my record. And so it can be a motivator too. I think another really important part of patients being, reading their notes is the fact that they can contribute to safety monitoring. Patient safety is a huge issue for every kind of provider. Care is really complicated. We're all human. We all forget things. And having another set of eyes on what's going on can probably help people avoid errors. We've heard stories of patients forgetting to follow up on referrals and reading a note several weeks later and remembering to do that. We've heard stories of doctors forgetting to follow up on a test. They were going to redo a test or order a test that they forgot to order, and patients can actually remind them to do that. So there's a safety component here as well. I think also that patients and doctors both, and I say doctors, but I really mean clinicians, as a product of reading these documents together and eventually producing them together, there's an increased trust component. There's an increased communications component. We have talked with several attorneys who really believe that reading notes and being engaged enough to call things to people's attention when they're not right could actually reduce the rate of malpractice, because it's a factor that can lower the rate of miscommunication. A lot of malpractice suits come from miscommunication, as we all know. And finally, I think patients reading their notes, thinking about them, enables them to come to visits actually better prepared. And we've heard this from both doctors and patients. Patients, just think more about the questions they want to raise at the doctor's office. And we've had clinicians say, just spontaneously, since my patients have been reading my notes, they actually have better questions when they come in. So I think there are a lot of ways that this actually contributes to patient engagement. And I should add, we're talking about patients, but it's not just patients. It's also their family caregivers at home who also have an interest in being completely up to date about the plan of care and the clinical rationale.
Well, that underscores, I think, the value of OpenNotes to the entire healthcare system. Correct, Ann Weiss? It's not just patients and doctors. It really could drive us to a system that is safer, as Jan said, has less in terms of expenditures on malpractice and so forth. What do you think, Ann, is the ultimate scope of the impact of OpenNotes?
Well, I think if you just look at the growth that Jan described since the initial experiment set off, we see the potential for a really broad platform to address a lot of the issues that we've been talking about today: patient engagement, and, managing your own health, safety, quality. And one of the great things about it is that it's wired into a system that we already use. Right? I mean, the patients' records and notes, that's part of the mainstream healthcare system. So it doesn't require a new app. It doesn't require people to use their smartphone. It doesn't require poor doctors to adopt yet another system of collecting data. It's the system we've had in place for many years, but using it, for so many more, to address so many more issues. So I think the potential, Susan, is very great.
We have a number of questions that have come in from participants in today's Hangout. Let me go to some of them now. One question that has come in from Trent Rosenblum, who's Vice Chair for Faculty Affairs and Associate Professor of Biomedical Informatics, Medicine, and Pediatrics at Vanderbilt. He writes in that many doctors and administrators are still worried about patients seeing low-quality notes. I guess notes that aren't written necessarily in terms that a patient could understand, or they're written very hastily and therefore don't have full information in them. first of all, how big a problem is that, and how do we address that problem? Jan, let's give that one to you.
So that is a worry that we've heard from doctors who are thinking about doing this. It's very interesting. When we talk to patients, they don't expect notes to be written for them. And they actually are very aware. They really understand how busy doctors are, and that these are not works of literature. They are actually quite aware of the context of note writing, so they don't expect perfect documents. That said, doctors do still worry about changing the way they write their notes. And I'd say, in our first survey, about 3/4 of the doctors said they didn't change anything. A quarter of them or so said they changed something. They changed the tone of how they wrote. They stopped using some terms, like especially acronyms like SOB.
Which doesn't mean what you might think. It means
no,
breath.
That's right. No, it's shortness of breath to us as clinicians, but something else to possibly other readers. And doctors also are very aware of the amount of cut and paste that goes on in notes, which can, be confusing and also just kind of hide the really important things under a pile of redundant text. There's a lot of awareness on both the writers and the readers of the potential quality issues with these notes, but we haven't heard of anyone stopping because of these issues. What we really think will happen is that the fact that clinicians are writing knowing that patients will be reading these notes, maybe they'll get a little better. This will be a subtle, perhaps not so subtle, force for change.
So another question that has come in was, do we believe that just having access to notes actually means that we understand the notes? And actually, Connie, I'd like to throw that one to you. As you read through these notes that your primary care doctor or even your specialist wrote about you, how did you feel in terms of understanding the content, and what were you able to do to make sure you understood the content?
Well, I mean, that varies from practitioner to practitioner. My primary care doctor's notes were very easy to understand because I was able to clarify them as they were being written. That cut back on a lot of the issues right there. But yes, I had a lot of specialist notes that were filled with terminology I either didn't understand and things like that. But the one nice thing about having them online is, I just opened up a tab, put Google right there, and I was able to get the information that I needed and post questions about anything that I didn't. To follow up on what Jan was saying there about the thing with low quality notes, I think one point that probably should be made, and I'm not trying to be flip, if clinicians are worried about exposing themselves and their low quality note taking process, I still think that it should be kept in mind that patients are exposing themselves in a major way too. They're coming in and talking about very personal issues that are directly affecting them in their daily lives, and there's a trust factor there too. But in this case, I think tie goes to the patient. If you're not willing to expose the shortcomings of what you're doing, I think it's really difficult and kind of disingenuous to ask patients to be doing the same thing.
So another question came in from Edmund Karras, who wrote, has OpenNotes addressed mental health visit notes and open patient-physician communications around what can often be a very delicate issue, which is mental illness? Jan, tell us about that.
Well, I'm really glad someone asked about this. as OpenNotes have spread around the country, most institutions start in med-surg and exclude behavioral health.
The
But there
medical
have been
surgical component of health.
Yes, but there have been notable exceptions. And we have a number of places now that have opened all their behavioral health notes to patients, including the University of Washington and Group Health. And BIDMC here in Boston, which of course is another academic medical center, has opened it's doing a pilot with psychiatry and social work. So it's both medications and therapy. Now that pilot has gone on for about a year, and it's been, from all reports, smooth sailing so far. The psychiatrists who started the program have actually added over the year as they gained experience. And we'll be surveying those. We'll have some data about exactly what happened with that, I hope, by the end of the year. The University of Washington and Group Health both went live in all of their ambulatory clinics, including behavioral health, in the fall. So they have had about 6 months of experience at this point, opening to all of their behavioral health patients. And again, we have heard of no negative stories about that. Now, I will say that one of the things about OpenNotes that we encourage providers to at least consider is to provide a mechanism where clinicians can exclude certain notes or certain patients from being read. And I think particularly in mental health, this is an important option to have because there are probably patients who should not be reading their notes. It's not appropriate. It's not a good thing for them. So providing this escape hatch, so to speak, I think is a good idea. But we do expect this to spread. We've had only good reports so far, and like I said, I hope we'll have data later this year.
But as I've heard your colleague Tom Delbanco put it, there is a sense in which OpenNotes could be viewed like a drug. You should look at who's appropriate to have that drug and when it's contraindicated, and you're suggesting there's an avenue to do that in OpenNotes under certain circumstances.
That's exactly right. That's exactly right.
So, Ann Weiss, here's a question I'd love to hear you address. Are there efforts to incentivize the use of OpenNotes, such as through the meaningful use criteria issued by, of course, the Office of the National Coordinator of Health Information Technology and the Centers for Medicare and Medicaid Services? Are there incentives available to spur the use of OpenNotes?
I'm not aware right now of any direct efforts, and Jan may be, where there's been a link between efforts to hold healthcare systems accountable for the things that OpenNotes might address and really leveraging them. In other words, I think that the questioner is asking a great question with lots of potential, lots of the ways that we're asking healthcare systems to be held accountable for better quality and lower costs. I think OpenNotes could accelerate progress on them. But I think at this point it seems like the state of play is where we're hoping that connection gets made out there. And I think, you know, a great direction to pursue in the future is trying to make some of those connections more explicit. Here's an opportunity. If you want to do better on this measure, here's a tool that can help you get there. I'm not aware that anybody's made that connection yet, but it's a great suggestion. Jan, any other thoughts about that?
So I don't believe there are any formal incentives in place at this point. We actually had extensive discussions with ONC when the meaningful use 2 requirements were being set, and decided that we didn't want OpenNotes to be perceived as a mandate from the federal government. And elected not to put it into meaningful use. However, I will say that under the meaningful use guidelines, which require patients to view, download, and transmit data, that OpenNotes is probably one way to get patients onto the portal. We have had at least one provider tell us that when they opened notes to patients, the logins to their portal increased dramatically. So meaningful use is definitely one avenue. We actually think there might be some other possibilities as well. And again, these are possibilities, but for example, insurers might be interested in incentivizing, particularly if there is an impact on safety. So this is something that we may be pursuing in the future.
So a question has come in from Adams Dudley, who's the director of the University of California, San Francisco Center for Healthcare Value. And he writes in that Connie's story is really interesting. How about caregivers? Is there any data on whether or how OpenNotes or similar programs help them? I'll just take the opportunity to say I recently completed a documentary about the Geisinger health system that has a vignette in it about how one patient, his wife actually was able to really take a very strong role in his care by virtue of having access to OpenNotes. In fact, he was using OpenNotes more than her husband, the patient, actually was. But what kind of data do we have beyond that one anecdote, Jan, about caregivers using OpenNotes?
I'm sorry, my sound is breaking up. Was that a question about caregivers?
Exactly.
Okay,
question about caregivers and what data we have about caregivers of patients using OpenNotes.
Okay, thank you. So it's interesting. In the very first survey, we had about 20% of the patients who said that they shared their notes with someone else, and it was most often a family caregiver. And I can't tell you how many times when we give talks and we get questions from the audience, almost inevitably someone mentions their elderly parent in another city. And if home caregivers could have access to notes, always with the patient's permission, of course, it would be very supportive of their caregiving role. And as we all know, or there is actually research that shows that being a family caregiver is an incredibly stressful role. And a lot of that stress comes from not being sure about the care plan, about the medications, about the clinical rationale, and having access to notes actually lightens some of that stress. We've heard from many caregivers describing situations where they better understand the care that they need to deliver. So I think this is a very big impact, a potential impact of OpenNotes.
So as we get close to the end of our time on this Hangout, I wanted to come back to you, Connie, and ask you for some advice to other patients and people, let's call them, because we all think of ourselves first as people before we become patients. What's your advice to people, first of all, who may not have access to OpenNotes to their systems? As you said, you were surprised to learn that OpenNotes aren't ubiquitous throughout the country. What's your advice to people who don't have access, and what's your advice to people who do learn that their systems use OpenNotes? How quickly should they get on board and start using OpenNotes?
Oh, right away. I mean, there is absolutely no reason to hold off. From a patient perspective, I can't understand why anyone would knowingly not have it available for their patients. And from a patient's perspective, if you have it available to you, you don't have to get as involved as it is I do. I can't imagine how many logins I get at Group Health, per month, just going through all this stuff. But knowing that option is there and that you have the ability to control your level of engagement, your level of empowerment, you know, you can take that as it comes. It's all, your healthcare is always going to be better the more you put into it. And since the healthcare system seems to be moving toward having patients being at the center of their care and of the decision-making process of what's going to be happening to them, the idea that you would possibly not take advantage of the opportunity to get all the information you can kind of blows me away, actually. But there are days and times when you're not going to be feeling all that up to doing this, and that's when you can turn, and I can look at a close friend, a family member, and say, you know, let me email you a copy of this, or let me let you into this. This is what I'm trying to do. You know, help me out. And it really works. It really works, and I can't imagine why any system would not want to have that option available to them and the people that they're caring for.
Great. Well, thank you. So, Jan, a quick last question to you. For systems that are not yet using OpenNotes, or for systems that are interested in expanding into our notes, what should they do to learn more about how to get involved?
Yes, I encourage everyone to consider this. We have a website, www.myopennotes.org, that has a wealth of materials for providers that are considering doing this. And we are also here. We have a staff in Boston. We are very interested in working with providers to answer their questions, help them make decisions, whatever we can do. We are here to help. So I encourage you to look at that website and contact us if you'd like more information.
And Ann Weiss, we're going to give the last word to you. Just finally, Homer Chin wrote in from Kaiser Permanente Northwest and said, OpenNotes is one of the few proven benefits of widespread adoption of electronic health records. What is RWJF planning to do in the future vis-a-vis expanding and continuing to support OpenNotes?
Well, we haven't made any very specific decisions with our partners at OpenNotes yet, but I think we heard a lot of themes today that point us in the right direction. Themes about moving from a passive tool to a more co-creating, contributing tool of equal contribution by patient and provider. Opportunities around specific populations or problems like pediatric and adolescent populations, or people with mental illness, or vulnerable, people who are economically disadvantaged. The caregiver aspect, I think, is very important. I think that one of the critical factors in early success was the research base, and so I think there may be a continued role for more evaluation and research. And I think the question raised about incentives was a good one. I agree with Jan that we don't want to, the ultimate goal here is not to make policymakers' jobs easier, but there may really be opportunities here to lift up the potential of OpenNotes as a solution to a lot of the problems we're struggling with in healthcare transformation. It's a very exciting time, and it's been a thrilling partnership for us.
Well, I want to thank our speakers today, Connie B., Ann Weiss, and Jan Walker, for a terrific hangout. And I also want to thank all of you participants in this hangout for joining us today. At the end of today, you're going to receive a follow-up email with a link to a blog post I wrote on the healthcare blog saying a little bit more about OpenNotes. We hope you'll feel free to comment on that blog, or otherwise indulge with us in carrying on the conversation about OpenNotes. We also hope you'll join us on June 5th for our next First Friday on Google Health. That hangout will be devoted to the Robert Wood Johnson Foundation support for planning and shaping healthy communities, and on our new Build Health Challenge. So again, we hope you'll join us for that. Thanks to all of you for joining us today. Have a great day.